So we've been engaged in a catch-22 situation in this aquarium because basically the fish were overfed for a while and then they were underfed for a while. Therefore, their immune system has deteriorated. And when their immune system has deteriorated, they've got white spot. And white spot is a very common disease that fish get when their immune system's low. Now, what's happened then is we started treating the fish for white spot. And some of the fish are starting to look much better. But we started with a half dose. And the reason why we started with a half dose is that there's some skinned animals in here. So most fish are scaled, whereas the skinned ones are more sensitive to medication. So therefore, what ended up happening was we went for a half dose. So therefore the medication definitely wasn't as effective, but we then redosed again because the medication wasn't really effective at the half dose. So then we slightly went above a half dose, and then we did lose a pictus cat. And a pictus cat is a skinned fish, so which means that they are more sensitive to the medication. And then this Synodontis, the big black fella that swims around upside down normally, are susceptible to medication. So we've got a real catch-22 situation, because if we don't medicate enough, then we don't get rid of the disease. If we medicate too much, then we can actually kill off the skinned fish like the clown loaches or the catfish. So as far as the water's concerned, KH is 7, which I'm very happy with. The GH is 19, which is on the high side, which I'm happy with. pH is 8.2, it's on the high side, but I'm happy with that. No ammonia, no nitrite, and there's not too much nitrate. So the water quality itself, I'm not saying is the problem. The medication versus the disease is the problem. So this Synodontis catfish here is showing signs of stress because he doesn't normally swim around on the top like this. So considering the water quality is really acceptable, and some of the other fish are really starting to look better now, I think that he isn't enjoying the medication. So the medication is no longer going to be getting dosed. So we need to let the medication level go down. And then it's my hope that once the medication reduces, that this guy should go back to normal. And then we need to leave the medication in the water because we need these fish to get rid of their white spot. So while they're swimming on the spot and flicking and scratching and the other behavior, they're definitely looking better. So I've done a few trips here recently and I'm not seeing anywhere near as much flicking or scratching as I did. So I'm very happy that the fish are starting to fatten up and look better than they did. I'm very happy that they're not flicking and scratching as much as they did. So I think we're on the right track, but we did lose the pictus, and he had a bit of hemorrhaging, which is a bit of blood in the fins and so forth, and that's just a result of stress. And I'm saying the stress is just due to the medication. So this is all catch-22. So I'm going to give this tank another week. I'm going to hope that the medication's able to do its job. We're going to slowly fatten the fish up because we really don't want the fish thin during this situation. So right now we're just in a really touchy time because we can't medicate properly and because the disease is not gone yet. So right now our job, really all we can do right now is cross our fingers, because we got to hope this fella's okay, and we've got to hope. He's a very old fish too, by the way. That's another thing we've got to remember, because I think this fish is like, I think he went in there from my memory and he was already a decent size. So I'm pretty sure this Synodontis is like excess of 10 years old, like well over 10 years old. So that's just another factor, because older fish, they don't live forever. Sort of 7 years is a pretty, 5-7 years, that's a pretty normal full life, 7 years for those guys. They certainly can live longer, but that's definitely a factor. So the silver dollars are looking good. This guy's very friendly. He's been following me around, the white lip. So now we've got to fatten them up, cross our fingers and hope.